Hello everybody, this is the Planet Earth here, going to tell you how to stop and eliminate your palpitations or lower your palpitations if you have a structural heart disease. If you have a structural heart problem, this may not work. If you don't have a structural heart problem, this may work. And probably will work because it's all about those electrolytes and anemia and stuff like that. Okay, now, here we go. Here's what you're going to do to stop your palpitations or eliminate your palpitations or stop some of your palpitations. Now, I can't stress enough how serious this is that you need to check your thyroid, your sodium, your potassium, your chloride, your carbon dioxide, your calcium, and some other tests that I'm about to show you, especially your thyroid. Ooh, the thyroid is so... Ooh, it feels good. Your thyroid is so important. The thyroid, and also... make sure you don't have diabetes. If you don't have diabetes, you can always rule that out automatically if your glucose is normal when you're fasting. And also make sure you have good kidneys. Your kidneys, if everything turns out fine on a CBC when they do blood work, you're going to request to your doctor these specific tests, and if they're all normal, look at the lower ends of the spectrum and try to make it higher. There's going to be something abnormal there because you just don't get palpitations for no reason. There's reasons for it. So I'm going to show you today. Now, okay. Alright, now. Okay, so this was taken last year. Glucose is 78. Cardio CPR, higher relative cardiovascular risk. This was actually high, but that was a false positive. Okay, so we're going to go down. The TSH level was really high, actually, back then. I actually had a bad TSH. I had a bad thyroid for some reason. 5.37, I was getting bad palpitations and rapid heart rates. No matter what medication I took, I was getting very bad palpitations and rapid heart rates. For some reason, it just fixed itself, and I'll never understand why. I'm not a doctor. You need to check your urine nitrogen and creatine levels. They need to be in range, or you'll get palpitations. I know why I was having palpitations. It's because of the sodium levels. I was having very low sodium levels because I kept drinking a crap load of water and I wasn't doing anything else. And I was just drinking lots of water because I like to clean out my kidneys. Well, I cleaned out my kidneys too much and I got water intoxication. And I figured that I was drinking too much water and I get all muscle weakness and stuff. So the sodium level was below 135. It was like 130 or 129. And that is going to cause palpitations. If your sodium level is high, you're also going to get palpitations. If it's low, palpitations. If it's here in this range, for America, this is for the United States metric system, whatever the hell they use, in this laboratory at least, it's in within range, so no palpitations. Potassium, for the contraction of your heartbeat. If you have low potassium, you need to eat potassium immediately, and that'll stop your palpitations if that's just the cause. If you have high potassium, never eat potassium, and make sure you get on a medication that lowers your potassium levels immediately. Your chloride level can be balanced. If it's low or high, it can actually be balanced with baking soda. If you're not on a high sodium diet. If you're on a high sodium diet, do not do that. But if you want to get your chloride back to normal, use some baking soda. Calcium, oh god, your favorite milk. If you don't have a good calcium level, it's below 8.6, you need to drink a crap load of milk. Get your calcium levels up, and don't take supplements. Just drink a lot of natural stuff to bring your calcium levels up. Calcium, palpitations. Think of this. C, palpitations. S, palpitations. P, palpitations. Calcium, palpitations. Sodium, palpitations. Potassium, palpitations. Chloride, palpitations. Glucose, if it's lower, if you have low blood sugar, palpitations. High blood sugar, palpitations. You need to get that treated. But if this is fine and everything else turns out fine on a regular CBC, complete blood count, then you need to start looking at your lipid panel. Your electrolyte disturbances. You need to look at potassium, sodium, calcium. Potassium, sodium, calcium. Yes. You need to look at these three here, which is sodium, potassium, and calcium. If you drink a lot of water and you do this to yourself, you need to drink salt. You need to drink about 2 tablespoons of sodium, which is baking soda, or just 2 tablespoons of regular table salt, and that should fix immediately almost. within an hour, your body will regulate all that salt. And if you don't have high salt and you do that, and you regulate all that high salt, you'll have a normal level right there. See that 138 in the middle of the screen? Yes. Now, this was taken last year, okay? So, make sure, if you're water intoxicating yourself by drinking too much water, you're going to feel like crap. Fatigue, muscle weakness, palpitations. Your heart needs electric signals to be going to be sent right. And if you don't have enough sodium, it's not going to be sent right. Same thing for salt water. Now, I'm going to move the video over here, and you're going to see my foot. And you're going to go to TSH levels. Okay, so now, your TSH levels. My TSH level was very high. That means I had hypothyroidism for some reason last year. And if that is abnormal, okay, you're going to have heartbeats, irregular heart rhythm, palpitations galore. So get to the palpitation view. You need to check your thyroid stimulating hormone. That is so important. You don't realize how important your thyroid is. Okay, and now we're back up here to the ceiling. You're going to see some unfinished wood here. That doesn't sound right. Now I'm going to go to the test I did last month, and then I'll show you the other one. Okay, this is the one I did. No, that was collected 411. Wait, what? No, this was 418. No, wait a second. I'm getting confused here. 411. Okay, this was the 411. 411. And... okay. Alright, here is last month's one. Okay, this was a complete blood count. The other ones are just mostly electrolytes. Make sure your cholesterol is below 200 if you're in the United States. This is common sense, people. If you have high cholesterol, get it down, because you're going to end up developing coronary artery disease. HDL needs to be above 40, and your triglycerides need to be below 150. Your LDL cholesterol needs to be below 130, and it's 84. So that's fine. So I'm thinking, wait, why am I having heart skips then? What's the reason? I'm not taking any medication that's ever known to cause it. Alright, okay, here is the complete blood count. Okay, urine nitrogen, this tests your kidneys and your urine. You know what I mean? 19, perfect. 0.95, perfect. So there's nothing wrong with my kidneys. So now we scroll down to sodium, potassium. Sodium, 138. It's still borderline, because it should be like 142. 141, 142, but it's low. But you can decrease that level really, really fast. And in the past, I've had a lot of problems with it going low because I drink too much water. And I don't drink enough salt. And I don't eat foods with salt. I hate that, because I don't want to have high salt. Alright, so your potassium level, if that is low, like I said, if it's low, bring it up. If it's high, lower it immediately. That'll cause palpitations. Dangerous palpitations. You can get dangerous palpitations from not having proper sodium levels, because that's your electricity right there, not necessarily the contractions. Okay, chloride needs to be normal. Your carbon dioxide needs to be normal. Protein total is, you don't need to worry about this. T4 thyroxine test 6.5. It's normal. Your complete blood count here, and this all needs to be normal. If this is normal, but you're still having palpitations, you really need to look into that as a electrolyte disbalance instead. Okay, so now I'm going to scroll back up to the one I took this month. Okay. Wait, that was 4/18, 2012. 2012. Alright, here's 2000, and this is the one I took this month. Okay. Hemoglobin, I checked for diabetes, don't have it. Decrease, increase, high, consistent with diabetes. Okay, don't have diabetes then, that's good. 91 is good. I think I ate like a candy bar before I went in there. Sneaky, sneaky. Okay, potassium, calcium, vitamin D. You need to check this vitamin D level because you can get depressed if you don't have enough vitamin D. And mine's 34. Reference range is 30 through 100. Anything below 20 is automatically should be deficient. Anything below 30 should be deficient too. Alright, here's the test that doctors usually don't do on you. Is magnesium. That magnesium is so important. It's not even funny. Okay, your magnesium needs to be at least 2.0 because the reference range ain't there that much. Your magnesium 2.3, 1.5 to 2.5. If your magnesium is low, you have low magnesium, you need to take magnesium supplements immediately, you'll have palpitations. If it's high, you need to not take any magnesium and avoid all foods with magnesium until it goes back to a normal range. You're going to have palpitations. Make sure your vitamin B12 level is at least above 200. I'm not too worried about it being above 1,100. That's not going to cause palpitations. Folate needs to be above 5 or 6, but not above 30 or 40. Your iron needs to be above 45. This is just an American reference, but iron total is 76. You're not iron deficient, that's for sure. Red blood cell count, you need to have it in normal range. Because if it is not in a normal range, okay, for our red blood cell count, that probably means you're anemic if it's low. If it's high, I don't know what the disease is on that one. Okay, so you need to check for that immediately. Also, if you have acid reflux, okay, check for H. pylori virus, because I do have it, and I'm going to get treated as soon as I go to the doctor next time. This won't cause palpitations, but if you have acid reflux, get tested for H. pylori virus by using a urea breath test, or ask your gastrologist to do an H. pylori test on you. Okay, this detected it, so I have the H. pylori virus bacteria infection. Also, so the ones you're going to want to check for is potassium, calcium, magnesium. They don't usually do magnesium tests on you unless you specifically order it. Ask for that. If it's out of focus, you need to get that checked. TSH level is now normal for some reason. It went completely normal. I don't have no problems anymore with the thyroid. Iron and B12 and folic. If any of these are out of shape, you're going to have palpitations. Mostly the ones, the potassium, calcium, magnesium, and sodium is the ones that are going to cause the palpitation problems. So you have to have those in normal range. If you're going to stop your palpitations, make sure your potassium's good, calcium's good, vitamin D is good, your magnesium, your TSH, which is your thyroid, and your iron, and your folate, and your B12. If all those are good, then you need to check on the lower range of the references to see which one might still be causing you problems. If you don't have a structural problem with your heart, and they've already done an echocardiogram on you, and they said structurally heart is fine and intact, but you're having some serious PVCs. I was getting PVCs because I was drinking too much water, and I didn't have enough salt in my body. So that can cause premature ventricular contractions. And those are not necessarily dangerous, but they're scary as hell. And so far, my heart rhythm has been stable for the last couple of days, ever since I drank a lot of salt. Your calcium, your potassium, your magnesium, your TSH levels here, and your red blood cell count, and your iron. If those are all good, but this is the test right here, iron and vitamin B12 and folate, that's if you're testing for anemia. Your TSH is for your thyroid. If your thyroid is normal, that means you have normal thyroidism. That's not going to cause you palpitations. Vitamin D is for depression. That's what I can't think of it as anything else. Your sunshine vitamin. 34. If it's below 34, you got a problem. Okay? Also check for glucose. Make sure you have normal glucose levels. If you do, that's good. Calcium is so important for your bones. Make sure it's in a good range, which it is. I have a lot of calcium. Potassium, make sure it's above 4 at least, and you won't have no palpitations. But because of my sodium levels, which was not shown in this test, I don't think. Let me see here. No, I never did a sodium test. I never did a CBC on the last month though. It was 138. Okay, so the sodium was 138, but with all the water I've been drinking, it lowers the sodium levels, and I end up getting palpitations and fatigue and muscle weakness because your body needs salt, and I don't eat enough salt. I'm not like a regular American. I try to diet away from the salt so I don't develop heart disease later on in life. So by lowering the salt levels, you can get PVCs, PACS, afib, no, not afib, but yeah, afib, a flutter even, if you don't have enough salt, potassium, and calcium, or chloride, or vitamin B12, or folic, or iron. If you don't have any of those levels and they're not normal, get them fixed. And now I've shown you what you need to test for. So I'm just going to give it to you in a general thing before I end the video here. I hope this will help you relieve your palpitations. If you drink a lot of water for some reason, for any reason, you're not drinking enough salt. You need salt. Put some salt in it. At least 1 packet of salt. 1 tablespoon, half a tablespoon of salt. Keep your salt levels in a good range. That doesn't mean you're going to get high salt levels in one day or over a course. You just need some salt. Because your body needs that salt. And I depleted myself. It was kind of like water intoxication. Low salt equals palpitations. Very bad PVCs too. Some foods cause palpitations in me, but with the salt, I don't get nothing. So you need salt. You don't need a lot of salt. Not a lot of salt. But you need some salt. Anyways, now, with the salt levels, I think I've just hurt my eyes now. If everything checks out fine still, and your glucose is 78, well, then you're good to go. But if you're having palpitations, and they're severe, and they're consistent, and even after all of this is checked out, and you do have good salt levels, you do have good calcium, potassium levels, and stuff like that, you might need to look into an ablation, where they shock part of your heart. That's the bad one, the bad part of it, and you won't have no more PVCs. And if you're on anti-arrhythmia drugs for actual arrhythmia problems, you might be able to fix it with potassium itself or sodium. Just make sure your potassium and your sodium levels are normal, and you won't have any problems. If any of these levels that I've told you are out of normal, you're going to have palpitations. Get the blood work done. Specifically ask for a magnesium, a potassium, a sodium, and a calcium. At least those tests. Get those tests done. Ask for a B12, specifically B12. Ask for an iron, and ask for a folate. If everything still checks out normal after all this and you're still having palpitations, and they're consistent, ask your cardiologist to do a stress test, an echocardiogram, and a dye test where they inject and throw a catheter up into your heart to see if there's any blocking going on. And if for some reason you're still having PVCs and PACs, you might be predisposition to it, or you need to have an ablation done. If you get the ablation done, you're not going to have any more irregular heart thingies. If you have a serious arrhythmia problems, even with normal blood work, you're going to have a pacemaker because your heart's just funky like that. But if your heart's not funky like that, you don't have no positions or anything, your all blood work is all normal, and you're having palpitations, try to increase your intake of, if everything is on the lower of the reference range, try to increase that and see if that doesn't help. But most likely, just getting it back into the reference range, you should be fine. Take some salt. If you don't eat salt and you're not on a salt intake diet and you don't get an edema, increase your salt a little bit. Increase your potassium. Eat an extra banana a day. Drink a whole glass of milk and you should be fine. If you get palpitations a lot, even after that, ask your cardiologist for a Holter monitor, or a 24-hour Holter monitor, or an event monitor. Get that done. Get yourself tested. Get those palpitations under control. If you're having palpitations when you're laying down, that's a sign of either a potassium deficiency, a sodium deficiency, or a calcium deficiency automatically, because I don't have a history of heart disease, and I'm structurally, heart is fine, and my thyroid's fine, and my adrenal glands are fine. So I hope this video has been very helpful for you, because it's very important that you get those palpitations to stop, because the more you untreat it, the worse it can get. You know, I've read some patients here that they're not learning that you need those electrolytes. That's what they call them, electrolytes. You need to make sure those are in perfect range or in good range, because if they're not, you're going to get palpitations. And also, if you're under stress and you have a bad anxiety disorder, don't usually get palpitations during panic attacks unless you are already on the lower end of one of your electrolytes and you have a structurally normal. If you have a structurally normal heart, you're fine. If it's structurally normal, they'll probably give you a clear bill of health. If you're structurally fine. If you have abnormal structures or heart valve disease, then you need to make sure you keep these levels normal anyways. But you really can't stop the palpitations or whatnot too much without our anti-arrhythmia drugs. But other than that, you'll be fine, and the palpitations should disappear and should go down in frequency. I hope this has been very helpful. Thank you guys for watching. This has been the Planet Earth here. Make sure you get those tests, please. Make sure you get these tests done. Thank you guys for watching. This has been the Planet Earth here.